My name is Rebecca Logan. I'm a wife, mum of 2 girls, and pre-COVID I was a nurse and fitness instructor. I worked part-time as a bank nurse in my local emergency department and ran my own fitness business, teaching 12 to 14 high-intensity fitness classes weekly. I loved my life. Now I'm grieving for that life. On 7th of April 2020, I contracted COVID whilst working in COVID ED. My initial infection was moderate and didn't require hospital admission, and almost 3 years on, I continue to live with long COVID, as my consultant just recently described as a cousin of ME. Is it okay? I now spend 75% of my day in bed and am housebound unless I am taken out. I use a stick and wheelchair to mobilise, and doing simple tasks such as getting out of bed and showering can result in even more severe fatigue and pain. Every day is a struggle, an endurance test. I suffer crippling and debilitating fatigue, headaches, brain fog, muscle and joint pain, muscle tremors and weakness, breathlessness, constant ringing in my ears, heart pain, lung pain, and post-exertional malaise. I have been diagnosed with chronic spontaneous urticaria since contracting COVID and was hospitalised with pneumonia last year. Other symptoms come and go randomly, but these are the main ones that I live with daily. By September 2020, 5 months from the initial infection, I felt about 70% recovered. Physically, I felt stronger, but cognitively, I knew I wasn't fit to go back to nursing. I returned to fitness instructing because, as with any other illness I'd had in the past, I believed exercising and pushing through would aid my recovery. Little did I know what lay ahead. After 4 weeks, I started to crash. I suffered from extremely high heart rate, my lips were turning blue, and I was having to stop during a class because I was so exhausted. I cut my exercise down and contacted my then GP. Unfortunately, after explaining my symptoms, I was told I was most likely depressed, advised to take antidepressants and just get on with my life. I was devastated and felt like I was going mad. As my health continued to worsen, at the end of December 2020, I no longer had a choice but to stop exercising as I deteriorated to the point I am at today. Stunned by the devastation to my life, I began to speak out on local and national media about the struggles of living with long COVID and the lack of support and services in Northern Ireland, and very unintentionally became an advocate for long COVID sufferers. Since September 2020, I had meetings with MLAs and members of the Health and Social Care Board asking that services for long COVID sufferers be implemented urgently. As a health professional, I am fully aware of the pressures the health service is under. However, I am disappointed that the long COVID service in Northern Ireland was only allocated £1 million and only began taking referrals in November 2021, when I was then referred, and 4 months later had an initial OT assessment by Zoom. The lovely OT explained she'd been pulled from her job to take part in the clinic, but unfortunately admitted she didn't have the time she'd like to research long COVID, nor time needed to develop interventions, as she was inundated with referrals. The interventions that were available were pulmonary rehabilitation, psychological referrals, and a referral to a dietitian. But I was discharged after 2 appointments because I was, quote, too ill to treat. Despite being too ill to treat, I have received no follow-up from the clinic or any referral to any other specialists. I've basically been left to self-manage. Desperate and with nowhere to turn, I tried many so-called treatments for long COVID, including travelling to Germany in January 2021 for 5 weeks trial treatment, including HELP apheresis therapy and triple anticoagulant medications. Nothing has helped ease my symptoms, nor is there any proven treatment to cure long COVID. In January 2021, I attended a Zoom meeting about ME, organised by long COVID patients who had identified the similarities in symptoms of post-viral ME. I had heard of ME, but as a nurse, never received any formal training or in-depth information. I did not realise how debilitating it was or the range of symptoms and couldn't believe the stories, almost identical to my own, and unfortunately the history of medical gaslighting and dismissive attitude. So it was only then I learned about post-exertional symptom exacerbation, or PEM, and learnt how not to worsen my already debilitated quality of life. I am convinced that by pushing through, I have caused long-term and potentially irreversible damage that sadly could have been prevented. If we have to learn to live with long COVID, then we need services that are face-to-face to help those suffering. We need early diagnosis and early intervention, appropriate diagnostic testing, treatment and support. Currently, the interventions offered are inappropriate in most cases, are remote, limited in scope, and don't deal with the pathophysiological cause of the condition. So just like the personal stories you've heard tonight in Discover ME, and while millions more, adults and sadly children, are left waiting for effective treatment, I too wish the healthcare professionals I'd turned to for help had been educated about post-viral illnesses and in turn could have warned me about the importance of rest in the early stages, instead of psychologising long COVID, telling me to push through the symptoms and just get back to normal. Thank you for listening.